Bonjour and hello. As president and on behalf of the PCC Board of Directors, I would like to start by respectfully acknowledging the unceded traditional territory of the Kukutlu people and the traditional keepers of this land, and I wish to give thanks for allowing me to bring this message to you today. This week is National Telecommunicators Week, and it's a time to celebrate and thank our emergency medical dispatchers, call takers, system status controllers, ambulance communication officers, whatever term is used for these incredible professionals. They play a key role in the delivery of paramedic service. As the first point of contact, the critical work our paramedic telecommunicators perform each and every day directly impact the health outcomes of those we serve. And for this, the PCC acknowledges and thanks you for your and contributions to ensuring the Canadian paramedic system is second to none. On April 9th, the Paramedic Chiefs of Canada Board of Directors and guests held an Advocacy Day on the Hill. Over the course of the day in Ottawa, meetings were held with numerous ministers, members of parliament, committee chairs, and senior policy advisors who were incredibly receptive to our message. As highlighted in previous video messages and in written correspondence sent out to members, we had three key messages to convey to the government. First, caring for the front line, which was about recognizing and requesting support through the Senate of Bill C-321, to amend the criminal code for assaults against persons who provide health services and first responders, while reinforcing the need to reaffirm the recommendations from HESA 29, which is from the Standing Committee on Health, that addresses the preventative measures before violence occurs through research, education, and continued advocacy. The second focus area was relieving the pressure. And in this, we spoke the need to prioritize access to the assets paramedic services need, such as ambulance chassis and specialized medical equipment, and to promote a pan-Canadian paramedic credentialing strategy to strengthen our national paramedic human resources as assets to support healthcare across provincial and territory borders, particularly during times of health system crisis. And the third area was expanding patient care. And this is to ensure that paramedics are practicing to the full scope as they have the training, skill, and ability to offer more than emergency care, improving healthcare delivery in all communities across Canada, but particularly in rural, remote, and First Nation communities. While these were the key messages we delivered, we had one specific ask, and that was the formation of a Canadian National Paramedicine Secretariat. The foundation for this first recognizes that the current healthcare delivery framework, the operational responsibility, and standards of service delivery remain under provincial jurisdiction. The challenge with this construct is that it creates systemic gaps in service delivery through inefficiencies in the coordination of a national healthcare strategy that includes paramedics. Coordinated strategies and initiatives at the level of federal government enable the required changes to help meet the future requirements of paramedicine in Canada and provides a voice with our federal partners in these conversations and planning. This ask landed solidly with those we met with, and follow-up meetings are already being held to discuss advancing this further. I would like to thank the guests from Canada in joining the board for this important dialogue. Thank you. There are a number of key dates that we hope you have circled in your planning over the next couple of months. To start, June 4th to 6th is the PCC Leadership Summit in beautiful Quebec City. Details of the summit program have been released with an exciting selection of topics and speakers. It will be an important 3 days of conversation shaping the leadership of Canada's national paramedic system. You're going to want to be there. And immediately following the summit, the 20th International Roundtable on Community Paramedicine will begin running from June 7th to 8th, and it's not too late to register for Summit and the IRCP. You can find details on the PCC website. The third annual Canadian Paramedicine Research Day is May 24th, and registration is now open. This is hosted by a national coalition of researchers and services, and as part of our Paramedic Service Week celebration, this virtual event will showcase exciting research from across the country. Over 2,500 paramedics registered for this event in 2023. This year's theme is Research to Practice, Evidence for Innovation in Paramedicine. That sounds great. Please visit our website for additional information on how you can register. The 2024 PCC board elections will be taking place next month, with nominations opening on Monday, May 13th at 8 a.m. Eastern Standard Time and will close Wednesday, May 15th at noon Eastern Standard Time. The board seats that are up for election this year are Ontario, Quebec, British Columbia, Nova Scotia, the Atlantic Regional seat, Yukon, and the executive position that is going to be open is for the president. All nominations and subsequent elections will take place via electronic means. Upon the close of nominations, members will receive an email stating the names of all the individuals nominated. In the event that only one individual is nominated for a board seat, they will be acclaimed. If more than one individual is nominated, an election will be required, and we'll send a subsequent email with instructions on how you can cast your vote. Details on how to nominate a PCC member for a vacancy have been sent to all members, so look for that in your email. Further instructions will be sent to you as well in the coming weeks. So lots to pay attention in the upcoming few weeks on that in your inbox. So if you've been considering taking a more active role in leading the medicine agenda, this is the perfect opportunity to get involved. If you're not sure what is required from being a board member representing your province or territory, don't hesitate to speak with any of the current or past board members. Or if you wish, feel free to contact me directly. Last, I started this message recognizing our paramedic telecommunicators, and while this week is highlighted to celebrate their specific role in paramedic services, they are part of a bigger team. May 19th to 25th is Paramedic Services Week, a time to celebrate all who are responsible in the delivery of mobile healthcare services to Canadians from coast to coast to coast. This year's theme is Help Us Help You, an opportunity to highlight the many ways that paramedic services help people, from our core provision of emergency care for those critically ill and injured to the more contemporary role of paramedic services as part of a greater health system. Help Us Help You reflects the promotion of this role in the health system that, together with healthcare partnerships, we can help our patients receive the most appropriate help that is going to promote optimal health outcomes. As events to celebrate Paramedic Services Week are in the works being planned, please be sure to share the ways that your service is using this theme to celebrate Paramedic Services Week. In closing, a huge thank you, as always, to our partners who make all of this possible. Without your assistance, we wouldn't be able to do the great things that we do. And these are particularly true of our gold sponsors, Furno, Demers, Crestline, Stryker, ESO, and Prehas. We're very excited to share with you that Zoll is also now a gold sponsor of the PCC. Thank you, Zoll, for your strong support. And we would like to welcome FirstWatch as our newest silver sponsor. Of course, FirstWatch has been a strong supporter of the PCC for many years, hosting our webinars, and we're welcoming them as an official partner of the PCC. I'm also thrilled to welcome PCC's newest gold partner, Lifeguard Digital Health. If you're not familiar with who they are, be sure to visit their website, lifeguarddh.com, and great supporters of the PCC. We look forward with working with Lifeguard Digital Health very closely. Our partners are who make it possible for us to actively advance and align paramedicine in Canada. And I thank you all for making that possible. And with that, thank you very much for sharing this time with me, and I wish you all the best in the days ahead. Until we speak again, take care, be well, and be safe.